Cholesterol is a type of lipid, an essential element contained in all human cells. However, excess lipids and other fatty substances in the blood can cause hyperlipidemia and other lipid disorders. Hyperlipidemia is a significant risk factor for development of atherosclerosis and heart disease. The cardiovascular system comprises the heart, blood vessels, and blood. Blood has many life-sustaining responsibilities, including transporting oxygen, carbon dioxide, nutrients, and hormones throughout the body. Blood contains red blood cells, white blood cells, platelets, and nutrients. Cholesterol also circulates in the bloodstream. Two common forms of cholesterol are LDL, known as the bad cholesterol,
On-the-scene coverage of ACC14 is supported by Janssen Pharmaceuticals Incorporated.
I'm Peter Block for On the Scene here in Washington, D.C. at the ACC annual meeting. The late-breaking clinical trials go on, and we've had 2 trials which studied anti-PCSK9. This second trial was done by Derek Rawl from South Africa. Derek, tell me about this study. It's different than the low-risk patient trial.
Yes, this is the study, the RUDVA2 study, is in with patients with familial hypercholesterolemia, which are probably the highest risk patients. So they've got inherited cholesterol. We estimate it's probably the commonest condition, inherited condition in the world. It affects about 1 in every 200 to 1 in every 500 people. So there's about 18 to 40 million people with inherited cholesterol around the world. Now the statins are remarkable drugs, but in this patient group, despite high-dose intense statin therapy, which can lower cholesterol by 50 to 60%, many patients with inherited cholesterol don't get to the LDL targets we'd like to get them. They don't get to 100 milligram percent, and they definitely don't get to 70 milligram percent.
On-the-scene coverage of ACC14 is supported by Janssen Pharmaceuticals Incorporated.
We're here for On the Scene at ACC at the annual meeting in Washington, D.C., and the late-breaking clinical trials continue to roll out. I'm here with Mike Karn from Jacksonville, Florida. And Mike has done a study on anti-PCSK9, which may in fact be an answer for patients that are statin intolerant. Mike, tell me about the study.
Sure, thanks Peter. The study is called MENDEL-2, and it's a study of Evolocumab, which is a monoclonal antibody, fully human monoclonal antibody directed against PCSK9. And the study looked at patients who were not on statin therapy. Actually, the reason we're doing this study is to understand the drug better in a phase 3 clinical trial. A lot of people don't know this, but statins actually raise PCSK9 levels. So it's important to do studies of these type of drugs both with patients on statins and with patients off statins, so we can compare the safety and efficacy with the 2 different type of patient populations.
Okay, so